Sister Ruth Kirchmeier is a specialist midwife who works as part of the fetal medical team and the pre-pregnancy counselling team at Birmingham Women's Hospital. During this interview, the issues surrounding the parents' treatment decision-making process, the lifestyle effects of complex heart disorders, and the risks to further pregnancies will be explored.
Most parents, when they're given this diagnosis, ask themselves whether there's anything that they could have done that would have changed things. And really, we would always reassure people that there's nothing that you could have done that would have changed the way the baby has been made. And the baby's heart is made at such a very, very early stage of pregnancy. Just when you're realising that you're pregnant, all those complex things are happening within the heart. And sometimes the wrong messages get through when the heart is being made, and that part of the heart sadly doesn't form. Whenever we find any abnormality in a baby, it always raises the question as to whether there may be any other abnormalities. And of course, scanning can give us a lot of information about physical abnormalities. The other question that is raised when we find any physical abnormalities in a baby is whether the baby's genetic makeup is correct. Every baby has its own individual genetic makeup, and that is inherited from the chromosomes passed on from both the mother and the father. Chromosomes are like packets of genetic information which are crucial to the normal development of a baby. If the genetic makeup in the baby is incorrect, this can lead to additional problems with the way the baby may develop. And so it is important that parents are offered the opportunity to consider having a test to look at the baby's genetic makeup. This at least then will give them the information to know whether they're dealing with a heart condition in isolation or whether they are dealing with a more profound genetic condition. You will be offered a test called amniocentesis. This involves putting a fine needle into the womb and removing a small amount of fluid from around the baby. The first part of the results will be ready within about 48 hours and will give information about complex chromosomal abnormalities. The second part of the results will take usually about 2 to 3 weeks and will be for more subtle chromosomal abnormalities. The different part of the results will be discussed with you individually and will form part of the information that you'll need to consider when you're making a decision as to what is going to be right for you and your baby. There are some heart conditions that we see on scan which are commonly associated with chromosome abnormalities or genetic abnormalities, but at the moment there's no single identifiable genetic abnormality that's specifically associated with single ventricle disorders. When parents are told that their baby has a serious heart abnormality, many parents feel that the likelihood will be that the baby will need to be born by caesarean section. On occasions, we do need to think about induction of labour to make sure that all the facilities are ready. Clearly, when you're in labour, you will have a midwife with you, and she will discuss with you at any point what forms of pain relief you would like. Parents often ask us how they can talk to their families about this condition, and it is a very serious condition, and we know that the long-term outcome is uncertain. But I think our feeling would be that it is very important that you're very honest with your family so that the implications of this difficult diagnosis are understood by everybody concerned, and that's not only yourselves but potential grandparents and other children that you have. It is a complicated condition, and the heart itself is a very complicated structure, and you may find it easier to show people by using the diagrams exactly how the heart is made and how the blood flows through it. The Quality of life for a child with a single ventricle really depends on how successful the operations have been. If all the operations go successfully, then these children go to normal school, and if you had a photo of a class of school children, you wouldn't be able to pick out the one that's had a problem with its heart. Clearly, having a heart with only one pumping chamber does mean that a child would not have the same physical energy that a child that has two pumping chambers would have. And so in terms of exercise, there would be a limit to how energetic a child with a single ventricle could be. There will be specialist baby doctors from the neonatal unit present when the baby's born, and that's obviously to make sure that the baby's in good condition at birth and well enough to be transferred to wherever the surgery is going to be undertaken. This doesn't, however, mean that you can't have a cuddle with your baby when he or she is born and spend some time with the baby before the baby's transferred to the neonatal unit. Depending on how well you are after the birth, we would hope that you would be able to accompany the baby to the surgical unit. We know that for any parent embarking on a pregnancy, the likelihood of having a baby with a heart abnormality is about 1%. And in other words, if we had 100 pregnant women, we would expect one woman to have a baby with a heart problem. When you've had a baby with a single ventricle, the incidence in the future of having a baby with any heart condition goes up from 1% to about 3 to 5%. So again, in other words, we would expect between 3 or 5 women out of 100 women to have a baby with a heart problem. Having said that, of course, if we turn that the other way around, we would expect 95 to 97% of women to have a perfectly normal baby. The second question that many parents want to know is what would happen in another pregnancy in terms of looking to see whether a baby has a normal heart. You would be offered in a specialist unit a cardiac scan to look again in detail at the baby's heart. In most units this will happen between 18 and 22 weeks. However, in some very specialist cardiac units, cardiac scans are being offered at around 14 weeks of pregnancy.